Chin. I'm a associate professor in thoracic medical oncologist, University of Michigan, and it is my incredible pleasure to speak with you today about targeted therapies in non-metastatic lung cancer. So here are my disclosures. So as we've been hearing quite a bit about in some of our earlier presentations today, we know that non-small cell lung cancer is really divided into these different molecular subtypes. And here we have a lovely pie chart and probably most updated pie chart about the different mutations that we're really looking into developing therapies for. We're also understanding that if your cancer has one of these mutations, they may have a different response to different treatments as well as a different a clinical course. When we talk about molecular testing, what do we really mean? So let's just take a step back because I think we hear a lot about molecular testing, but sometimes it can be really confusing. So you can hear it being referred to as genetic testing or next generation sequencing, molecular testing, mutation testing. We all use these terms almost interchangeably to kind of refer to the same process. What I like to emphasize is the molecular testing that we're really focused on here is not really genetic in the sense that it is passed on from a parent to a child. So these are not necessarily inheritable mutations, but what we're really looking for are actually specific DNA changes that are occurring in the cancer cells themselves. And so when we undergo this sequencing, what occurs is that often these biopsy samples or a surgical specimen is sent to a specialized lab. And then from there, they can extract DNA from the tumor cells themselves, and they look at the sequence and they're looking at the molecular changes that are occurring in the sequencing of specific genes. And that is how we arrive at whether or not lung cancer belongs to one of these molecular subtypes. But what I like to emphasize, and I think is the key point of my talk today, is that you can't know if the lung cancer belongs to one of these molecular defined subgroups unless molecular testing is performed. So what happens when these mutations occur? And Dr. Roto just gave a phenomenal talk about EGFR, and I'll also use EGFR as my example here because it is probably one of our most common mutations. So EGFR belongs to this family of ERB receptors. They can be found in normal cells. And what it stands for is epidermal growth factor receptor. And so what happens is when a signal comes from outside the cell, it binds to the EGFR, which is that green little tuning fork here. And this activates this downstream pathway, meaning that it tells the cells internally to send signals for cell growth, cell division, things that it should be regulating. We know that it's found in the skin, in the GI tract, and different lining of the body, in your nails. And this is why, as Dr. Oto mentioned in her talk, when you have these EGFR therapies, it can have these side effects in the skin, in the GI tract, in the nails, etc. But when these mutations occur that we're really interested in, what happens is that now this cell growth signaling continues, irrespective of whether or not there's an actually external signal telling it to occur. So essentially, what is happening is now your cells are growing independently of whether or not your body is telling it to grow. And that is actually a very key defining feature of cancer in general, is essentially the cells are growing without your body's ability to control their growth.